Thank you to everybody, and once again, welcome. Thanks again to CAHO. This is also going to be interesting. Strides made, successful implementation, and lessons learned. I think it's in connection. I think the previous speaker was Dr. Jani who said that the culture needs to change. I think one important aspect that we all need to understand is that we need to sensitize healthcare workers, healthcare professionals about technology. CAHOTECH, I think as one of the objectives is to sensitize our colleagues all over the country as to the uses of technology. AHPI has actually started a course on this along with Indian Institute of Science and ISRO. And we've written a book again for healthcare professionals, which will be published in November. So I think it's important that we start sensitizing our people at the ground level and slowly change the culture, the thinking of us. Now, going back to the discussion, it's my pleasure to welcome and again introduce Dr. Sangeetha Reddy. I think, as was earlier said, we've got some giants who are part of this program, and Dr. Sangeetha Reddy needs absolutely no introduction. Just briefly, she is a very highly respected, highly recognized global healthcare leader, and her achievements are into many pages, and all of us are aware of it, and of her immense contributions globally. She is very closely connected with policy makers and also implementation. I think Apollo, just in brief, I want to tell you that they have touched more than 13 million lives. They have leveraged technology and have made it accessible, especially during the COVID season. I think so. It's time now to hear from the horse's mouth how technology has been leveraged to provide affordable, quality, and we've been talking about accessible again and again. Accessible quality care, especially in the rural and semi-rural areas. Over to you, Sangeetha.
So, namaste and good evening. So, let me begin by saying that it's a privilege to be amongst individuals who are committed to harnessing the power and the potential of technology, to bridge gaps, to erase inequalities, and to contribute to bringing healthcare to every home, to every family, and making the world a better one. And I think India is uniquely positioned to reimagine healthcare and to conceive it and to build it in a universal healthcare for our country, but also in some interesting ways, it has the potential to make us the lodestar or the kind of the one leading the way of a reimagined healthcare for the world. And I think we kind of gained one more step towards that positioning when the unprecedented health crisis was dealt with by India in such a manner. The power of partnerships, innovation, technology. I mean, the COVID app, the way that we were able to do, I think, 2 crore 16 lakh vaccinations is something, and to be tracked in that manner, to be available real-time live. So India truly stands tall on the world stage as a fine picture of the possibilities in matters of technology, and that position it always had, but now in matters of deployment of technology towards healthcare. So we're always known for our great doctors and our great engineers. I'm so happy that things are coming together on both fronts. Now, serving the needs of a population of 1.4 billion people, and some tremendous speakers before me have spoken about. I think Dr. Arish Sharma described the system. We spoke about the problems. We looked at, how it's going to be done, how we take these silos and put them together. So I'm not going to refocus on any of that because I've been asked specifically to talk about, what is Apollo viewing? How are we looking at this? And, what do we believe is the way? Let me just say that from the very beginning, we were very committed to the use of technology in healthcare. So whether it was our early HIS system, our partnership with ISRO to create the country's first telemedicine in the year 2000, where we connected our village, and then, just moving forward of hybrid models, bringing virtual care and inpatient, digitalization, increased AI adoption, the focus towards precision medicine, connecting machines, looking at moving our data onto the cloud. And now I think our belief in all these is just getting stronger and stronger because the amount of data is enhancing. genetic testing is becoming commonplace. And one very important point that is another large driver, I think, even at a national level, not just at Apollo for me, is that with the the growing tsunami of non-communicable disease and the large population we have, we know that science tells us that if you screen and catch a disease early, your outcomes are completely different. We also know that most NCDs are lifestyle related, so you need to communicate with the individual. What better way to approach this communication or this bringing the individual into care than using technology towards it? So every day I get more enthusiastic about the importance of the use of technology in helping us create a healthy country and a healthy community. So just kind of moving on to, I'm going to, in no particular order, share a few of what we are doing. So to begin with, across the Apollo ecosystem, hospitals, clinics, home care are digital 24/7. We have a unique healthcare identifier. The UHID is for the simple reason that you should be able to flow or move from one care environment to another. To be really honest, we put this into a non-Apollo company and invited others to participate in the UHID, and we did this almost 14 years ago. There are a few hospitals who did join that ecosystem. Today, I was part of the team when Mr. Satyanarayana was writing out the National Digital Health Policy and gave the concept of UHID as well as the PHR. And I'm very happy to see that when the government presents this, then all of us can participate in it. But currently now, a UHID and a PHR system are already working within the Apollo ecosystem. We have about 14 million patients on the PHR. And the power of that is that we can move them, the doctors can see them, other members of the care team can also see their records. So if you say an endocrinologist is looking at a patient who has diabetes, but you cannot cure his diabetes with a prescription and 15 minutes in the consult room. But if his data is available to the dietitian, to the exercise therapist, to the care counselor, you build disease management programs, enhance the way you treat your patients, and therefore very, very powerfully, just to share our sugar program, which is based on this ecosystem or this common structure, we saw that people who were subscribed to our program, 85% of them brought their HbA1c down from 8, 9, etc. to below 6 within a period of 90 days. So this, I think, is the power that when all the data, all the, the systems, everything is of no use unless we can use them in tangible ways for our patients. We are all healthcare people. That's what we love. And therefore, everything that we do, we kind of focus on how is it going to impact a patient or impact a doctor. Now moving to, our telemedicine network. I think that, like I said, it's 22 years since we began this journey. We moved from satellite to point to a many-to-many system. MedIntegra is our system. So doctors from other nursing homes log in, non-Apollo doctors log in to ask, but many patients log in to ask. And now this is transformed into our digital platform called 24/7. We also have deployed this platform, and I think this is, many of you know about 24/7, so I won't talk about it, but some of the work we've done, which is not known, is that we run primary healthcare centers for the government. This is, of course, on a not-for-profit basis. But we have telemedicine for the doctors or the specialists who are not available in the PHC. And we have empowered the primary care doctor in the PHC, of course, with our learning module, but also with the clinical decision support system. So this doctor who worked in the government system or who worked in his own private practice for 10 years, 15 years, who had not probably attended a CME in the last 10 years, gets the latest information on how to treat his patient. If he wants to escalate it, he can do a telemedicine at the touch of a button through our central pool. And if he wants to refer this patient, he can refer him to the district hospital as well. We are also recommending that the ASHA workers are also integrated into this platform. So we build what I think is the most important, and that is continuum of care. Because if you look at it from the patient's point of view, He goes to a GP. GP says, go to this diagnostic center. He has to repeat his whole history again. He hand carries those reports, comes back to the GP. The GP says, you need to get a second opinion. He carries all these reports and goes to a hospital in the city. And here I want to, re-highlight on the power of telemedicine to make geography a history. Because in a study of Aragonda, our first telemedicine platform, 83% of our patients could be treated in that small village itself and need not travel to the large hospitals. So it's important for us to find ways to create care in their own environments. Let us rethink what's happening in the large hospitals and figure out what we can do closer to the patient. So the eSanjeevani platform, similar such telemedicine platforms, then delivery of medicine, then using the PHR to get second opinions. So there's a range of things which are evolving. And once we get those well structured, then the next aspect of the whole story is that we can deploy AI and ML to predict health risks, to allow our doctors to perform at their highest level of skill, because the AI, the ML, the chatbot, or even a nurse using this capability, or even a healthcare worker who's trained for 6 months, using this information can work with the healthy individual, the slightly sick individual, or the patient to enable compliance. All of us know, I mean, we've done a detailed, heart surgery. He doesn't take his medication. He comes back with another problem. So these are the type of things that we can, completely transform. I won't go into 24/7, but our thought process is really that this will be an omni-channel health platform, combining the physical with the virtual. We currently are covering about 19,000 PIN codes in India, have over 14 million people who are on the platform, and are continuing to work to build a clinical intelligence engine which will enable doctors, Apollo and non-Apollo doctors, and patients, Apollo and non-Apollo patients, to really find a way to access the type of care which is possible. There are various other parameters we're working on, whether it's our connected ambulance, so you can treat a patient in the ambulance. We're looking at camera-based headgear, body cams for paramedic staff, looking at ultra-fast, low-latency Airtel 5G platforms. We're very, very excited about EICUs, about remote care in all its dimensions. HNG has something called an auto-maid, which is a remote patient monitoring, so that the nurse doesn't have to go running to the room even when the patient needs just some water or is unable to close their window, their curtain. So there are hundreds of these, teleophthalmology. And so it's exciting that all these are coming together and that we can share these platforms. I'm very happy to share, to partner, to create. But I think the final and the most important thing is to work towards universal healthcare, to focus on prevention, to share knowledge. And I think we must all talk about the incentives for us to adopt the National Digital Health Mission, the need for education and a structure, and to look at what is the legal framework to protect us. We must thank, the work that happened on the Telemedicine Act, which enabled this to move forward. But I just want to end by saying that together we can dream of a healthier world, and together we can make these things happen. And there are many foundational steps, of many of which have been spoken, but I also want to talk about the work we did on standards. I think one of the speakers spoke briefly about the fact that we don't have data and standards. India adopted LOINC as well as SNOMED, and CDAC has taken that. We worked with them on this to make it a quick list of SNOMED. So some of these are important learnings and programs that I believe we should educate our own ecosystem, so that together we can take the power of what is happening and not be left as bystanders, bystanders just watching this transformation of healthcare, which is definitely happening. Let's make it happen at our pace, respecting the healthcare worker, respecting the doctor, and respecting what we really want, which is a healthier, happier world. Congratulations to CAHOTECH and to all the people who are working on this very, very powerful methodology of non-linear growth of healthcare using digital. Thank you and namaste.
Yeah, thank you, Sangeetha. That was an excellent talk, very inspiring, and you have shown us how we can leverage technology to make quality healthcare affordable, and such excellent outcomes.
Thank you, Sangita, for being here.
Yeah, thank you once again, Sangeetha.